We are 27 months into our fight against COVID, and in that time we've made tremendous gains to keep communities safe, and by we, I mean the entire community. The entire community has done so much to try to live through this virus, to learn to live with it, and to take the advice of the public health experts. The number of cases in our county is very, very high, but the cases are beginning to decrease. And the best news is our hospital usage is low for this current wave. So in past waves, when we've had this many cases, and we see it particularly in the wastewater, the reporting is down just because of the at-home tests, as folks know already. We've seen higher hospitalizations. Now there seems to be that decoupling between the cases and the hospitalizations, and that's good news. We are seeing a slight increase in ICU bed utilization from COVID patients of late. So I'm in communications with the public health department about that, and obviously we can't let our guard down. We don't know what the next variant might bring or the next subvariant, but we're watching very closely, and so far so good. But of course, none of this was accidental. A big part of it has been people doing their part and getting the vaccine. And of course, we've got big news to share. We heard the news from the FDA and the CDC last year that the vaccines are approved, the pediatric vaccinations from Pfizer and Moderna for infants and toddlers, kids 6 months of age and up. And so we are going to be administering what we're calling the little pediatric vaccines through Harris County Public Health as well. And I want to make sure the entire community is aware that we're providing that service at our sites free of charge. Folks can visit readyharris.org, or they can call 832-927-8787 to schedule an appointment. You can schedule an appointment for you, you can schedule an appointment for your child, for your loved ones, or you can show up at one of our vaccination centers. If you visit Ready Harris, or you call the number, you'll learn where our vaccination centers are. We've got about 20 sites going every day, pretty much. The hours vary by vaccination site, but starting tomorrow, we are going to be administering those little pediatric vaccines right here in this community center and many other community centers all throughout Harris County. As always, the vaccine is absolutely free of charge. No questions asked other than whatever we need to be able to follow up with you for a second dose if necessary or more. And then we have folks ready at all our sites to answer questions, to help with services, to support the kids. Everyone's getting trained. All of this past week they've been receiving training so they can administer the vaccines properly for the little kids. So I know how long parents and caretakers of our little ones have been waiting for a vaccine for the little babies, and the day is here, and Harris County Public Health is stepping in to also, alongside our hospital like Texas Children's, make sure that we're providing those vaccines. Children, of course, do not face the same risk of COVID as adults, but that doesn't mean that there isn't a risk and that we shouldn't keep them safe. We've had over 15,000 kids in this age range of 6 months to 5 years old experience COVID. 119 young children who've died, who have been hospitalized 0 to 5. We've had a handful who have died, but even infants can get long COVID. So it's important to protect young children, to make sure that the whole family has those vaccines. Both vaccines, Pfizer and Moderna, for these particular ages were studied in thousands of children, and there have been no reported cases of serious illness in all of these trials. So especially now as kids go back to school in the fall, as parents are looking for childcare with younger kids, this is a great time to get the kids vaccinated, and also recognizing that there's another wave coming likely, and we don't know what that wave is going to hold. So to take the time now to get the vaccine, to get that second dose, third dose for one of the vaccine makers, that takes some time, and so it's important to start that regimen now for the kids. Now, we're talking about kids today, but I can't stress enough the importance of getting vaccines, period. the time to build immunity is now. As a community, the vast majority of people have their vaccine. Between around 75, close to 80% of folks in Harris County have at least one shot. And then as far as fully vaccinated, that number is just behind. So if you don't have your vaccine, you're very, very much in the minority. And folks that are having COVID these days are having mild symptoms, partly because of the variant, but partly because they have the vaccine and they're able to stay out of the hospital, and we're seeing that reflected in our trends. So this is how we're going to continue making progress, and how we're going to protect our community and make sure that COVID becomes a distant memory, that the idea of a pandemic becomes a distant memory. So the recommendation is for everyone to get vaccinated. Now, every parent has the opportunity to protect their kid from COVID-19, and I hope that parents will take that opportunity. Let me repeat in Spanish very briefly, and then I'll pass it on to Dr. Brown, Dr. Rafael, and to Chara. Llevamos ya 27 meses de lucha contra el COVID-19 y hemos progresado bastante. Y el progreso ha sido debido de los esfuerzos de la comunidad y particularmente los esfuerzos en cuanto a la vacunación. Hay tantas personas que han tomado ese paso, que han trabajado porque la comunidad esté protegida contra este virus. De hecho, la comunidad latina, en cuanto al porcentaje que han recibido la vacuna, ya no está detrás de otras comunidades. Ya estamos al par, por ejemplo, de otras comunidades que tienen un nivel alto de inmunizaciones. Ahora, los casos se han estado incrementando dramáticamente. Pero lo bueno es que las hospitalizaciones siguen en un nivel bajo. Hemos visto un incremento leve en las UCIs, pero realmente por ahora la situación está bastante positiva. Hay buenas noticias también. Se ha aprobado la vacuna pediátrica. El Departamento de Salud Pública del Condado Harris va a estar administrando esas vacunas también, y son estas vacunas para los niños de 6 meses a 5 años de edad. Lo que llamamos el Little Pediatric Vaccine. Y estas vacunas ya están disponibles en tantos hospitales, pueden obtenerlas a través de su pediatra, pero también quiero que sepan que a partir de mañana viernes el Departamento de Salud Pública del Condado Harris también va a estar administrando las vacunas. Esas vacunas son absolutamente gratis, deben ser gratis, sea donde sea que usted vaya, que usted lleve a su niño. Pero puede tener toda la seguridad que si visita una de las sedes de vacunación del Departamento de Salud del Condado Harris, la vacuna es gratuita, no se le hace ninguna pregunta acerca de su estatus migratorio, mucho menos. Entonces, los invito a que traigan a sus niños, a que se pongan esa vacuna. Es algo importante y que ayudará a toda la comunidad. Puede registrarse en readyharris.org o llamar el 832-927-8787 y también puede presentarse a una de las sedes de vacunación sin cita. Nuestros equipos están perfectamente entrenados, le podrán responder cualquier pregunta que tenga usted. Pero lo que sí sabemos es que se ha estudiado esta vacuna en miles de niños y no se han reportado ningún caso grave de enfermedad por causa de esta vacuna. Pueden siempre haber efectos secundarios, pero son mínimos, como cualquier vacuna. Los niños no tienen el mismo riesgo, no se les presenta el mismo riesgo de muerte, por ejemplo, que a los adultos o adultos mayores en cuanto al COVID-19, pero sí sabemos que 15,000 niños en el condado Harris de 0 a 5 años han sufrido del COVID-19, 119 han sido hospitalizados, algunos han muerto e inclusivamente los niños muy pequeños pueden contraer el COVID prolongado. Entonces, esa es otra razón para vacunar a nuestros niños. Y bueno, obviamente debo invitar a todos a que se vacunen, sean o no niños. Ya ahora sí que no hay excusa, de los 6 meses hasta los 100 años se puede poner la vacuna y la gran mayoría del condado está vacunado. Así el 80% de los residentes del condado Harris tienen al menos una dosis de la vacuna y es por eso que estamos viendo esto reflejado en nuestras hospitalizaciones. Pero viene otra ola del COVID, no sabemos qué va a traer esa variante, qué tan fuerte va a ser, qué podría causar en los hospitales. Entonces, el empezar la dosis hoy día para poder recibir la segunda dosis, el refuerzo, antes de que llegue la siguiente ola, es lo que se recomienda. Y bueno, gracias a todos los que se han vacunado, los que están vacunando a los niños, porque estamos viendo eso reflejado en el hecho de que no nos está impactando tanto esta ola como ha sido en el pasado. Hemos sufrido bastante por este virus, pero a medida sigamos todos poniendo de nuestra parte, vamos a seguir avanzando. Entonces, with that, I'll pass it on to Dr. Erica Brown to speak on behalf of Harris County Public Health.
Thank you, Judge. Again, as Judge Hidalgo stated, Harris County Public Health would like to strongly recommend that parents and guardians get their children 6 months of age and older vaccinated. Vaccines will be available at all of the Harris County Public Health sites, which can be found, again, on readyharris.org. And for an appointment, again, you can call 832-927-8787. It is extremely important that we do protect our children. Unfortunately, in the last 2 years, COVID has become a leading cause of death for our children. It has been shown as well that this vaccine has done a phenomenal job at protecting against severe illness, not only for adults, but for our children. So again, we strongly encourage you to get your children vaccinated, and we are available at multiple sites around the county. For our smaller infants around 6 months to 2 years of age, for any concerns, we encourage you to reach out to your pediatrician and discuss any concerns about risk that you may have, although we do know that the vaccine is efficacious and safe. So again, we encourage you to get your children vaccinated. You can reach out to readyharris.org or vaxtrack.hctx.net or call 832-927-8787 to make an appointment. I'd like to turn this over to Dr. Raphael with Texas Children's to speak specifically on the vaccine. Thank you.
Good afternoon. I'm here as a very excited pediatrician to really show my enthusiasm and excitement just about having the availability of this vaccine for those children who are under 5. So for us, we've been waiting for months to years for this to come about for this age group. And so I've had families call me, I've had families text me saying, when is this vaccine coming? When is this vaccine? I can't wait to get my child vaccinated. And that just really highlights just the overall enthusiasm in the community on behalf of families, caretakers, daycare centers as well, but I'll speak on behalf of pediatricians since that's what I am. And so for us, these vaccines are very safe, they're very effective. They were trialed in thousands of children across the country, and specifically here in Texas and in Houston, we had large numbers of trial participation across all groups, racial minority groups, other groups as well. So we should feel confident in what the vaccine has to offer in terms of its effectiveness and safety because it's been tested for everyone. And so what we've demonstrated, or science has demonstrated, is that the Moderna as well as the Pfizer are exceptionally protective, again, as we said, against severe disease, against hospitalizations, and that is great news for our communities. That's great news for our families as well. The vaccines have also been shown to be safe. So when you think about, well, what are the side effects, people ask? Well, the side effects are the typical side effects you see with a number of vaccines. The most common side effect is going to be a sore arm. You get that with the flu shot. You get that with your other vaccines. So that's a very common reaction that we're all used to. Other common side effects are going to be some fever, some headache, some fatigue. So again, imagine all these other vaccines where we get a little tired, we rest for a little bit, maybe take the day off, watch a good movie, and that's all it is. And that's what it's going to be like for kids. There haven't been any demonstrated severe reactions or complications that we need to worry about. So again, with thousands of kids involved across the country in these clinical trials, and a ton of them here, right here in Texas, I think we should feel very assured that these vaccines are safe, they're effective. And so we've talked about already why our children are vulnerable. So there are a number of reasons. One is just that their immune systems are still developing, they're immature. So having the availability of these vaccines is tremendously important. Children, like we said already, are very susceptible to getting sick, to getting severe disease, to being hospitalized, and unfortunately even death. And we do see that in our hospitals locally and nationally with children. So that's another reason that these children are so vulnerable. Then also, if you think about children, exist within the context of their families. And a lot of our children, particularly underserved children, live in multi-generational homes where there are grandparents, cousins, aunts, uncles, multiple siblings. So they sort of inherit all the risks of everyone else's activities. And for those of you who remember being a toddler, remember being young, or have toddlers of your own, it's hard for them to do these safety measures. So how do you tell a 3-year-old to sort of, distance safely and all of those other measures? So for all those reasons, it's important. The other reason we specifically think about with children is there's a condition called multi-system inflammatory syndrome, where a lot of their organs can get inflamed. And that is specifically, again, for children. So just having these vaccines available is such big news for our families, again, for caretakers, for child care centers. It also allows people to go back to a normal life again, just, again, thinking about sleepovers, being in daycare centers and camps. For these younger children who haven't been able to participate, this is substantial in terms of ensuring their mental health, their ability to develop normally, and just to access all the things that their older age groups can be. And then the last thing I would just say is that it also protects the rest of society because, again, children can get it, but they can also pass it on. And now with the vaccine, we're decreasing the likelihood that they're passing it on to more vulnerable adults. So in every way possible, this is a major victory for pediatricians and families, and I couldn't highlight that enough. So I'm going to pass it to my colleague.
Commissioner Adrian Garcia wished that he could have been here today with all of us because keeping families safe from COVID-19 has been a major priority of his from day one. Therefore, Commissioner prepared a statement for me to share on his behalf. Thank you all for being here at our Access to Health Smart Pod for this important announcement. I'm proud of Harris County's work to get as many people vaccinated as possible, particularly in our underserved areas. I'm especially excited that the vaccine is now approved for children 6 months to 5 years of age. And I would encourage any family with the child of this age to please come and have them vaccinated. It could save their lives. I'm proud to have worked alongside Judge Hidalgo and Harris County Public Health Department's leadership in getting this done. My daughter is fully vaccinated, and if she were eligible for this vaccine, I would not hesitate in bringing her to be vaccinated. And I hope all parents will take advantage of this opportunity to protect their young children from COVID-19. On behalf of Harris County Precinct 2, Commissioner Adrian Garcia. Thank you.